There's already enough of a bitter debate between adults about whether or not to get the jab, but what will happen when you add minors to the mix? Well, South African authorities have yet to roll out the COVID-19 vaccine to those under the age of 18. But once juveniles get the go-ahead from the health department, does that automatically give them the freedom to choose whether or not to get vaccinated, or will it be up to the parents to decide? And let's make things even more complicated. What happens if one parent is pro-vaccination and the other is vehemently against the jab? Well, to give us some clarity on what will likely soon be a burning question, we're joined now by public health lawyer Safura Abdool Karim. Safura, thank you as always for your time. Let's just take a step back here and look at globally when governments are taking the decision to vaccinate under 18s.
So this has been an incredibly hot button and controversial issue within the realm of vaccine equity, because what's been happening is in very wealthy countries like Canada and the US, governments have opened it up to children, whereas we still have healthcare workers who are unvaccinated in sub-Saharan Africa. So there is a raging debate about the ethics of vaccinating children who don't experience severe disease, while frontline healthcare workers are still exposed and still at risk for severe COVID because they're unvaccinated. So it's still something that is being resolved globally.
When our babies are born, I think at about 6 weeks, we give them, and over a period of several months, we give them vaccinations against measles, other potentially fatal diseases. So what rights do underage children actually have on whether to get the vaccine or not? Should it be made available?
So the current situation is that in order to take a vaccine or any type of medical treatment, you need to consent. And because children under the age of 18 are unable to consent, generally their parents give consent on their behalf. There are a few exceptions. For example, I believe if you're over the age of 12 and a woman or a girl, you can consent to have, for example, a termination of pregnancy without your parents' consent. So generally it is that a parent would consent on their child's behalf to them receiving the COVID-19 vaccine.
I suppose it would get complicated if one parent was pro-vaccination and another parent was very anti. Could the child then make their own decision?
This is not a new question, unfortunately, in the realm of medical ethics. We've seen this happen for occasion where, for example, a Jehovah's Witness doesn't want their child to receive a blood transfusion, and it becomes incredibly complicated. The prevailing principle under our Constitution is that the best interests of the child must prevail. So where there's a disagreement between two parents, or where doctors recommend that the child be vaccinated and the parents disagree, generally you have to follow a litigious route where the judge would actually appoint somebody who's independent to make a determination about what medical treatment a child should receive. Whether that is actually the best thing for a child is really up for debate. I've heard stories of, for example, after a child of a Jehovah's Witness receives a blood transfusion, the parents are reluctant to take the child home with them. So there's a lot of complexity in this question. It's not a clear-cut issue.
At the moment, most people that I know are isolating because their teenage children are COVID positive, and it's been very difficult with them going to school and keeping them apart socially to stop them getting COVID. You were saying offline that we're at about 11% vaccinated in SA, and most countries are looking to only vaccinate under 18s at about 70%. So we've got a long way to go.
That's correct. And I think, again, we really need to prioritize groups of people. South Africa, as much as we have this amazing vaccine rollout that's moving really, really incredibly fast, there's a shortage of doses. We don't have enough doses to give everybody in the country, full vaccination of Pfizer, for example. And so I think we need to be really, really thoughtful and careful about whether or not we choose to vaccinate children and when that decision is made. yes, children are becoming, the carriers of COVID infection from schools to home, but really they were getting it from teachers. And so by vaccinating teachers, we've sort of played a considerable role in reducing that risk of exposure. So I think it isn't necessary that you need to target children. There are other avenues that you can interrupt the spread of COVID-19 vaccines. So it isn't like that's the only solution to protect adults, but it is quite an important component of it. So we do need to think about it at some point.
This is such a multi-layered topic, Safura. We could actually talk again and again every day about some form of COVID-19 and the vaccination. Thank you so much for your time, as always. That was public health lawyer Safura Abdool Karim.